Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Welcome back, everybody, to another episode of Keiser Voices. We are continuing and ending our conversation for Black History Month, but also introducing our next podcast topic, which is also Women's History Month. So we're excited to have a very well-rounded, versatile guest today, Dr. Lawren Mundy. She is our program director for our Women's Health Nurse Practitioner program. But not only that, and I would be doing her an injustice by not telling you guys a little bit about her before she says hi to you. She's been in the nursing field since 1999. She started out as a registered nurse, got her master's in nursing, became a nurse practitioner, achieved her PhD in nursing, and specializes in topics such as human trafficking, women's health, gynecology. And she is an active practitioner in Palm Beach County currently. And when she's not in the classroom, when she's not in her office, she also spends a lot of time in the community, educating and providing health services to populations that may not otherwise have those opportunities to have those conversations or have those services, and has even traveled to other countries to provide assistance. So, Dr. Mundy, welcome to the podcast.
Thank you. Thank you for having me.
So we want to talk first off about how we can empower Black women in healthcare and having that conversation on health needs and advocacy, but it's also Health Month, and we're getting ready for Women's History Month. And with your background in women's health, I think this is a fantastic way to wrap up Black History Month, wrap up Heart Month, and then move into Women's History Month. But what inspired you to pursue the career in nursing and in women's health? And does that at all relate to your understanding of Black women's health needs? Did that play a role in that when you were making those decisions?
Well, so actually my mom is a nurse. And so I think underlying that did inspire me to become a nurse in some way. But initially, like working in labor and delivery, I just knew that I wanted to work in women's health, and there's nothing else that I would rather do in the medical field as well. I love teaching my patients about healthcare, about themselves. A lot of women just in general don't even know what like their period really is or what ovulation is. And we go through this, and we all go through this. I mean, what is perimenopause? What is menopause? So teaching is a huge aspect for me when it comes to women's health. And I love to see how they learn, how they respond to it, and how they can improve their lives and also their children's lives too because of it. So, but not initially knowing in regards to Black women and disparities. I think you kind of learn about it as you go along and you work in the healthcare field. But for certain, from what I've learned, from what I've experienced, I am a huge advocate for making sure that we take care of Black women, understand their healthcare disparities, encourage them to be able to get healthcare, even, explore opportunities to be able to give them quality healthcare and make sure that we help to decrease those healthcare disparities.
What are some of the key health issues that we see that Black women have to face or are often overlooked in healthcare? And what changes do we need to make to even begin to address it?
Right. So heart disease is the number one mortality cause in Black women. We also have pregnancy complications. Black women are 4 times more likely to have mortality in pregnancy as compared to white women. And then also obesity is a factor too when it comes to Black women in healthcare. And the other one is breast cancer. Breast cancer, there's a great disparity there between white and other races too as well.
And it's my understanding, and again, my medical and biology background is not fantastic. Oftentimes I get the opportunity to learn what I learned from our faculty and our nursing students, which I'm so appreciative of. But these health issues present themselves differently in different races, ethnicities, and even in the genders. Like, they all do not look the same. So oftentimes when we're looking at studies or we hear about studies being conducted, we also need to keep in mind how it looks on other people or in other people. Is that correct?
That is correct. So some of my patients actually make fun of me. One of my questions on my health history, I ask them is, do you receive dental care? And they're like, why are you asking about the dentist? And I'm in a GYN office. But it's so evident that gum disease, if it's not taken care of, can lead to heart disease, right? And just like you mentioned, different races present atypically sometimes. And in general, women present atypically when it comes to heart disease. Like you can be having toe pain and you can be having a heart attack at the same time, right? So that's how you present yourself. So I always say, just make sure you get to your dentist. And dental health is so minor in this country. It's so like low down on totem pole. Like, oh yeah, when I get there, I get to it. But as you know, as I just explained, if you're not taking care of your teeth, of your gums, that can lead to heart disease. It's like a direct cause. So I try to make sure that I bring that up when I speak to them in their wellness visits.
How can Black History Month serve as a reminder for healthcare professionals to recognize and address unique challenges faced by, Blacks, even Black women in healthcare?
Yeah. So I think it's a good month to bring the awareness to, but an awareness that we need to continue all the time. So that's a good initiation point. Like, oh, you know what? Black women are at higher risk for heart disease, for breast cancer, for pregnancy complications. We see the mortality rate is absolutely, ridiculous in regards to that. So I think it's a good starting point to say that we need to look out for women, Black women, and make sure we take care of them and make sure that there's any healthcare disparities, lack of getting to healthcare access, maybe developing health fairs that we bring in the mammogram mobile vans to be able to accommodate and to be able to help them out, but to make sure that you initiate it there, but it goes throughout the entire year and not just only be in February.
What advice would you give to young Black women aspiring to pursue careers in healthcare, particularly women's health fields like women's health nurse practitioner?
Please do it. Please do it. We definitely need more, right? I've had so many of my patients be like, thank you for being here for me. Or like, I've driven an hour and a half to see a Black female provider that can understand where I'm coming from and relate to me and be able to give me quality care. And actually, though, that shouldn't happen. I feel like any provider that you see, you should be able to obtain that from, but they feel comfortable. And so we need more of Black women WHMPs to be there so that you can have your patients come and relate to you and feel comfortable and get quality healthcare. So yes, please do
it. In addition to encouraging to pursue, educational backgrounds in healthcare with like WHMP, like you mentioned, how can we better support Black women in navigating the healthcare system and ensuring that their health needs are properly addressed?
Well, so I just brought up one idea is definitely, I think going out to the community, because sometimes lack of resources, lack of getting to healthcare is an issue. So go to churches, out to those communities, give health fairs, discuss those things, bring in the mobile health vans, bring the care to the patients, and I think that would be one way to be able to help that out. Or maybe set up something where you have like a local driving service that can bring the patients to the care too as well. And sometimes even like, childcare is an issue that they don't want to bring them. But I think we need to be more open to that in offices that, they're going to bring their child, they have them there. Sometimes, you can have them there and watch them and just to get her through a visit, but I think we need to be, more open to options like that instead of restricting or saying like, if you don't get here within a certain time, you can't be seen. But, I think that's a big thing too.
And I'm glad you mentioned like that going out in the community or having more community events. I mean, that's something that you actively do with your current students. Can we talk a little bit about that? Because I am always so impressed when I've heard from your students or even in communicating with you, you guys make time. And then you not only do you make time yourself, because like I introduced you, you're a practitioner, you're an educator, you're the program director, but you instill this sense of community and giving back. And maybe it's a nursing, it's something with nursing in general, this need to be actively in the community, because I hear it from nursing students all the time about how can I provide free services and how can I help Can we talk about that and what you instill in these students? Because it is just so impressive and amazing every time I hear about it.
Thank you. Yes, I'm huge on service learning, whether it's domestic or if it's international. I think it brings a sense of pride in that you're helping others that can't get to healthcare services. You're bringing it to them, and it's free, and you're feeling that good feeling on the other end of it. I also feel like you get encountered with situations that you may not encounter in a routine office that you would have. So trauma-informed care, you get to teach students about that. How are you going to care about a patient who has been recently raped? How are you going to speak to her? So teaching students that part is also very, very important to me. And I feel like we have that access to when it comes to being in a community. Because once more, sometimes a patient who has been recently raped, they are afraid to come into an office and see you. But if they're with their community, they feel more comfortable. And if you're going to be placed in their community setting, maybe they're more likely to open up to you. And then now you can definitely be able to provide more services for them.
That's amazing. What tips or suggestions, or even something like you wish you would have known when you started pursuing your nursing degree? So that piece of advice that you would give to women, Black women, or even men who are looking at the nursing field and looking to pursue a practitioner degree, what advice can you give to them looking at this healthcare field?
Oh, it's amazing. There's so many different aspects that you can take. If you don't want to see patients, you can work in informatics or work in, the business or the leadership aspects. If you don't want to see patients, you want to teach, you have that aspect there too as well. So there's all these different facets that you can go to, or you can combine them, like I'm seeing patients and also teaching, and doing a plethora of things. I also think, and I instill this in my students too as well. So 90% of you being a WHMP is clinical, but we're also prepping you to be a leader, right? Mm-hmm. So leadership means, going back to your community, teaching, giving, presentations, whether it's to your colleagues or whether it's to the community, and helping out in that way too. And make sure you join, organizations that you're able to give back and to help out, and to also to keep furthering the nursing career too as well.
And lastly, before we let you go, looking towards Women's History Month, what are some key health factors that women really need to pay attention to?
So big ones, so heart disease is one, obesity, PCOS, which is polycystic ovarian syndrome, endometriosis is another big one. Average time frame for diagnosis from when a patient first complains about, was it pelvic pain or pain with intercourse, is 10 years. So we majorly need to work on that in the women's healthcare sector to shorten that time frame to get our patients treated earlier. Even specialists that specialize in endometriosis, there's not a lot of them, so if you want to go into women's health and you want to specialize in endometriosis, there's lots of room for you to grow in that area, which is phenomenal. But yes, endometriosis, irregular periods, how obesity can impact our periods, infertility is another big one. So there's lots of topics, lots of diseases when it comes to women's health that we need to be aware of. Even breast cancer, and even though we've had a plethora of research on it, it's still one of our big risk factors and one of our mortality factors in women's health. So
amazing. Thank you so much for your time today, Dr. Mundy, and educating us not just on Black History Month, but also on women's health and history.
Yes. Thank you.
And if you guys have enjoyed this conversation, be sure to like, share, subscribe, and follow the Keiser Voices podcast as we continue our conversations across a multitude of fantastic topics. We're wrapping up Black History Month, but we're moving into women's history. So some of these conversations are going to continue on that we started talking about today with Dr. Mundy. So thank you all, and we'll catch you next time.
Thank you.
Thank you for journeying with us today on Keiser Voices, the story of success. As we close this chapter, remember, every story has its next page.